who are considered high risk for COVID, or someone who is currently under quarantine because of a possible exposure, or any resident that has been diagnosed with COVID or is suspected to have COVID, they may request a delivery through our service. Our volunteers will deliver any purchased goods to your residence, and they will leave them on the doorstep and then contact you. So there's no exchange face-to-face, that it's contact-free. And they also make sure to wear masks and wash their hands often when performing the delivery. Any items that are purchased could include groceries, over-the-counter medicines, prepared food, or non-food items. And I do want to stress that if it is prepared food, we will only deliver from locations that do not currently already offer delivery. And we cannot guarantee that the food will be hot, but just give us ample amount of time and we will bring those to your home. To request a delivery, you first purchase your items online or over the phone at a local business, and then call our hotline number. It is 237-7234. So 237-7234, and you'll share the pickup information for your order. Make sure to give us as much advance notice as possible, just so we have enough time to find out which volunteer will be performing the delivery. And our delivery volunteers will go pick up the order and then bring it right to your residence. There is no charge for this delivery, and items must be purchased beforehand through the store. Our volunteers will not handle any money. If you do need any additional assistance financially, please contact 211. Our county has done a wonderful job of setting up resources available through that directory, so just call 211. And I believe we have had a few calls to our hotline just asking for assistance with doing the online order, and we are not currently able to send a volunteer to help. So I just encourage you to help any friends or family members that you may know who would like to do this online delivery, online option, and just walk them through how to do an online grocery order or any other items. And once again, our number is 237-7234, and next will be Melissa. Thank you.
Thank you, Jenna. I'm Melissa Magstead from Quick Care Clinic, and also had the privilege of leading the volunteer COVID hotline group. That hotline came out of a request from the healthcare providers that were getting lots of questions from clinics and things like that from persons on wanting to know more about COVID, wanting to have some help in discerning what symptoms they were having. And that line has been going on for quite a few weeks right now. And we as healthcare providers want to thank the volunteer hotline group for helping us with that response. There's a lot of education that needs to happen. There's a lot of questions that people have, and the hotline has really been helpful in that. I also want to thank the community for your commitment to taking care of yourselves and taking care of one another. As I'm listening to Jenna talk about the volunteer, COVID volunteers that are helping get food to persons, and the leadership of the city council, and the leadership of manufacturing and healthcare providers, that you have done such a really good job of taking care of yourselves and taking care of one another. And I want to thank you from that as a healthcare provider, that the reason that we were so aggressive at the beginning of this was to flatten the curve, if you kind of remember that. And you have helped us do that. And you're continuing to do hand hygiene, and you're continuing to take care of one another, and you're continuing to stay home if you're sick, and keeping that social hygiene from one another with 6-foot spaces and all those sort of things. And I just want to thank you as a healthcare provider for that. And I want to, some of the things that we're kind of seeing on the front line right now with COVID is that we are seeing persons who have been having symptoms for quite some time before they come and get evaluated. a lot of the questions when I ask people, I said, well, how long have you had symptoms? They'll say, well, I've been sick for about a week, or I've been sick for 4, 5, 6 days, whatever it is. And I would really encourage the public to be mindful that those body aches and those fevers and those coughs that you're having certainly are a part of potential COVID symptoms. And if you're wondering more about that, call the COVID hotline. And I hate to call them old doctors and nurses. I'm going to say seasoned, knowledgeable providers are willing to answer those questions. And so if you start having those body aches, you start having the chills, you start having fatigue. People have complained about changes in taste and smell. They've complained about severe fatigue, dry cough. Don't just poo-poo those things, and call the COVID hotline, and they will help you sort through that. 753-1408 is where you call, 753-1408. Call that. You're going to be able to talk to a professional very, very easily, very quickly. They're going to answer your questions. And don't sit there and go for 4, 5, 6, 7 days. Because if you do that, guess what? You're also doing this with your family and grandma and grandpa that you met over the weekend and went to a family barbecue. All of those things, those are how those viruses are passed along. And if you address that earlier, get tested earlier, monitor your symptoms earlier, and get in contact with people who really know their stuff by calling the hotline, you're going to be able to keep yourself healthier and also the people that you care about healthier. So 753-1408. You can also call the 211 line, and they'll get you connected as well. And our hours are every day. Every day we can take a phone call from you, 9 a.m. to 9 p.m. and Monday through Friday, and then Saturday 9 to noon and Sunday 1 to 5. So every day you can contact somebody about these symptoms. Don't think you're a bother to us, because you're not. Not at all. We exist to answer the questions. We exist to take care of you. So you know what? Do a favor to the hotline people and call them and keep them busy all day long with your questions. They love it. That's the reason they did this. So I want to thank you to the community for taking care of yourself, taking care of one another, and ask you to continue to go forth, and we'll get through this together.
Thank you, Mayor Karen, Jenna, and Melissa, for your update. Do we have any questions from the media? No? Well, thank you, everyone, for joining us today. Have a great day, and we will see you again on Thursday at 3:30 p.m.